Just to start off, I am going to be talking today about a topic that is personally fascinating to me. And I've used some of this in my own practice, but I wanted to share the information because I think it's something that we don't talk enough about with the brain. And that's the brain and our senses. And specifically, I'm going to be talking about two senses today. I'm going to be talking about the sense of smell, and I'm going to be talking about hearing, but in relation to music. So I'm hoping that some of this information is helpful to those of you who want to learn a little bit more and perhaps integrate some of the information into your daily lives. And as I start, I'm going to be talking, but what I want to do is at the end, I want to leave some time available. So Mary will cue me if I'm going a little bit over. I want to leave about 15 minutes at the end for questions and discussion. Absolutely, whoever wants to share is able to share, but there is no pressure in this environment. But I'm happy to hear if you have any comments or reflections. I'm happy to hear that. I think that is important because many of you are experiencing a brain injury, and it's always important for me to want to hear some of the feedback from the participants as well. So I'm going to start with my intro. Mary did a really great job and introduced me. I want to give you a little bit more background just to let you know that, so I graduated many years ago from the University of Toronto, and I've been working for 27 years. I would say that the brain has fascinated me since I was a child, to be honest. And so when I went into occupational therapy, it just seemed to be a right fit that I would sort of focus on the brain. So I have been practicing for 27 years and sort of focused on neuro rehab, particularly brain injury. I have been practicing in brain injury for many, many years. And most of my caseload right now, I would say about 90% is brain injury, and it ranges from concussion all the way to severe brain injury. And I'm also one of I don't think it's as common for OTs to sort of span across pediatrics, so children and adults, but I really do enjoy working with everyone. So I do practice with children. So I go from very young all the way to elderly. And to be honest, I find elderly some of my best clients to work with. Never underestimate an older person. So I've been doing that for many years in my practice. I've been deemed an expert witness for acquired brain injury. You know, it just sounds nice, but I really don't believe anybody is truly an expert. I think we're all still learning, and there's so much still to learn about the brain in particular. I also enjoy volunteering. So I'm happy to tell you I'm actually a board member on BIAR. I have met some of you. I look forward to meeting some of you. Hopefully some of you will be attending our mixer on June the 2nd. Please know that you can go and register, but tickets are not for a fee. They're free for those of you who are members and caregivers. So we look forward to hosting that, and nice to see everybody in person. And we're going to try and do it as safely as possible. I'm also the mom of 2 children. I have to say that it's important that I say that because it's part of my role. So I have a daughter who's 21 and a son who's 17, but also I wanted to just share that I have had some experience with brain injury. My son has had a series of concussions, especially when he was young. And I have experienced it also on the personal side as well. So, and you know, I was mom then, I was an OT. So I actually had to reach out for supports, just like many of you have to, because we kind of can't merge the 2 roles. It doesn't fit very well. And just to tell you a little bit about myself, I love OT. I really do. It's a passion, and I'm very thankful that I'm able to practice a profession that I really love. I enjoy running, walking, a lot of movement, and I enjoy music, volunteering, and travel. And travel obviously is dependent on many factors, but hopefully we can all return to some sort of travel, whether it's locally or abroad. So I'm going to be, if you look at the screen, what I've done is I've actually try to simplify this. I'm very aware of who I'm presenting to, and I don't want to make this more complicated. So I'm going to really kind of stick to the 2 topics. I'm going to first talk about power of smell, and then I'm going to talk about the power of music. power of smell, I'm going to be spending a little bit of shorter time on, and I'm going to be spending a little bit longer time talking about the power of music. If you feel that you want to learn more, because really I could go on about these things even longer than we have, we could do a part 2 if that's something you want to do. So just give that feedback back when you're asked for feedback. And at BIAR, I hope you do know that we do really read your feedback. We absolutely do. We listen, and we want to do the programming accordingly. So I'm going to start with the power of smell. There was a request, and it doesn't have to be that you're doing this, but if you have a scent with you that is a familiar scent to you, that because we did request this in the original registration, that you have a scent with you. So if you have a scent with you, I'm going to ask you to take a smell of it right now. Okay, if you don't have it, do not worry, you don't need it. But I'm actually going to be practicing something while we're doing this, and I'll explain it to you as we go on. So I'm also doing a little bit of brain training and brain priming with you as well at the same time. So take a smell. If you have something, while I'm talking, just take it in, and whatever it conjures up, just enjoy it. For those of you who have not who don't have a strong sense of smell, who have lost your smell, that does happen in brain injury. It's actually not uncommon. You don't need to do this portion of it. You can just be listening and participate and learn. And then when we go on to music, there will be some other priming activity that I'll be doing. Okay, so I'm going to go on. So to start off with, and this is probably going to be the most complicated screen you're going to see, but I really do believe in empowering people with information. And I've tried to make it easier in terms of what I'm presenting. Sorry, I'm just going to go back to that screen. When you look at the screen, you're looking at the brain, and you're looking at it sort of like sliced in half this way. So if you see the person there, Mary, can you see my cursor as I'm moving it around on the screen?
Yes, I can. Yeah.
Okay, perfect. Okay, so you're seeing the view of how this brain is being presented. So it's kind of going down, cut down in the middle. The main areas I want to show you is the thalamus, which is at the top. The name is at the top, but if you look, the thalamus is actually in the middle, deep in the middle of the brain, in the middle of what we call the cortex. The thalamus is like the relay center of the brain. Okay, so messages, all the information goes in, and then it disperses it. It tells it where to go in the brain. So when you see, hear, and touch or taste something, all of that information goes to the thalamus. And then the thalamus says, oh, I'm going to send it to, for example, the hippocampus, which is the memory center. Okay, and it's going to go somewhere else. The only sense that does not do that is the sense of smell. What happens is the smell, when you take a breath of something in, so you smell something in, the receptors in your nose, the cells in your nose, take it immediately to the area of the brain which is known as the smell center, the olfactory bulb, we call it in the brain, which is sort of the front of the brain. And what happens is it's kind of stored right there, but the smell center is so closely in proximity to the memory center and also the emotional center. The amygdala is the emotional center. So these are the three that I just really want to highlight right now, is that it goes in and it goes right beside the memory center and the emotional center. Why is that important? It's really important when we're talking about the power of smell. Because when you smell something, and think back to your own experience, there are times when you could just be doing something completely different, and all of a sudden the smell comes in, and all of a sudden you have this immediate trigger of a memory, whatever was associated with that smell. And it's quite strong. And it's not just the memory that gets triggered. You can also be taken back into whatever emotional state you were at that time. So for example, if you smell something that was comforting, so if I'm making something and I'm cooking something that my grandmother used to make, and I can smell it, it gives me this very comforting feeling when I'm smelling the aroma of whatever I'm cooking. And it takes me back to being in the kitchen as a child with my grandmother. And immediately I start having those memories. And those memories are stored very deeply in the brain. So I want you to remember this as we continue, because I want to show you the power of the smell. But now you know why the smell is so strong. The memory tied to it is so strong. Is because of the way that the brain encodes the information. It just goes straight into the center of the brain. Again, for those of you who have the smell with you, take another whiff. I want you to do this while you're learning this information. So just take a smell, breathe it in, and we'll continue. So when we talk about smell, it's really an area that I feel like has not been studied enough. There are more studies coming out on smell and learning, but not enough, really. I don't feel there's been enough focus. And sometimes, you know, we underestimate our senses. We don't talk enough about our senses. But the minute that we are at risk of losing a sense or we lose a sense, it's huge. It's a huge loss to the person who's lost a sense. It's one way that we now lose of taking information in from our environment. And for those of you who may have different impairments, you know, we can learn different ways, right? So we can learn with our senses, and losing one of those senses can be really hard. What I'm going to do here on this slide is I'm going to briefly, and I really tried to simplify it because I really don't want to go through the whole study with you. It's quite long and tedious, and we don't need it for our purpose. But I want to summarize a study that was done in 2020. And they were working on past studies that had already been done on this. But this study really came out with some interesting information. So they did a study that looked at smell, sleep, and learning ability. And they took groups of students. So these students did not have any brain injury or insult to the brain. We call insult meaning any type of injury to the brain. They were students that were in classrooms. So they were learning specific vocabulary tests. But what they did is they took these students and they split them up into different groups. And I'm going to focus on the group that received all the sensory smell cues, the cues for the smell, because that's the one that is the most important here. That's also the one that had the most significant effect. So they had split them all up. And obviously, when we're doing a study, you also have to have a group that got nothing so that you know what's working and what's not working. So they had that. They had one group that was just learning regularly, not having any other cues. And one group, what they did is specifically when they were studying at home. So the interesting part of this study is it was done outside of a lab. And that's why I want to talk about it. So it was done in 2020, but it was more like real life study, which I, as an occupational therapist, really look at, because a lot of us we're not in the lab, we're doing things outside and we want to do them in real life. So how does this apply into a real life situation? And then I'm going to tell you what I've also done in my practice using this kind of concept. So they used the sense of smell, and what they used with the students, because the easiest thing that they could use is they gave the students sticks of incense. I don't know if you're familiar with incense, but people can usually burn incense and it gives off a smell. In this case, they did not burn the stick, but the stick itself had a very strong rose smell. And they gave all the students in that particular group these sticks of rose smell. And so when they were studying at home, the sticks were near them. And while they were studying, they could smell the rose. They weren't aware of it at some point, because your body becomes kind of used to a smell. So although your brain is still smelling it, you're not actively aware that the smell is as strong. But these students were learning and smelling it at the same time. Then what they did is when these students went to sleep at night, the smell was placed in their bedroom. So these sticks were placed near them, perhaps at their bedside table, where they could still smell it. It wasn't lit. Again, it was just the aroma was in the room. The reason why they were doing that is because we know that memories are strengthened at night in the hippocampus of the brain. So if you go back to my my slide, the hippocampus, like I showed here, is the memory center, okay? So at night, while we're resting and things are happening, some really fascinating things are happening in our brain. Our brain is working. Our brain is actually working hard. And so one of the things that's happening is the memories are being encoded in the brain. So what they did is they did this for several days, and the kids continued to study with the rose smell. Then during testing, so at school, they had that same group have the sense of smell, that rose smell available to them during the test. That happened 7 days later. What they found is out of all the groups, the group with the rose smell made the least amount of errors. It was significant enough that for the purpose of this result, this test, it was enough for it to get published, and it was enough to say that learning occurs. And they wanted to show that it didn't have to happen in a lab setting, so they could do it in a real life setting. What I've done personally, and I did this with a student of mine, I was treating a student. So I asked the mother, she was 16 years old, and this was a couple of years ago, and she had a concussion. She had a pretty severe concussion. She was having problems studying, and she was also getting anxious. So I kind of thought, you know what? She told me smells are comforting to her. And I thought, you know what, let me try to use the smell in 2 ways. Because if you remember in the brain, the centers in the brain where the smell is also close to the emotional center, okay? The amygdala, which is the emotional center. So I asked mom and I asked the girl if it was okay if we tried something. So she was studying, I think she was doing a biology test. And she was studying, and I told her, I was with her, and she brought me a vanilla candle that she really loves. And she was smelling it as she was studying. She kept it there. And we did this for many days when she was studying. I had accommodations for her at school because she had some issues. We got her to be tested in a quiet room, and she was allowed to bring the candle with her. So she was using the candle also in her bedroom. She was keeping it in her bedroom. The smell, she always had it anyway, because she found smells to be comforting and relaxing. But what I saw when she was studying is that she was calming. She was also calming. And so, you know, I can't say for sure if that was just the candles, the smell of the vanilla, but she was definitely getting more calm. But when she went to do her test, she called me the next day to say that she had gotten her highest mark in months. And so, you know what, I can't conclude for sure that this was the reason, but it was enough for me to say, wait a minute, there's something here. I want to keep trying this. So I don't do this with everybody. I don't believe that every approach works for everybody. All of you are individuals, and the brain is like a thumbprint. It's an individual thing. So what works for one person may not work for other. But there's some general things that we can try that will work. So I did this with her, and you know, it worked in her instance. And I'm not treating her anymore, but it was something she really hadn't thought about before. And now her mom was going to be using this a little bit more as I discharged her. So if we talk about tips for smell and memory, you know, I just want to kind of give you some real life tips. What can we do? So like I said, brain injury can sometimes affect the sense of smell. Okay, so if that is your situation and your smell has been reduced, there's still no reason why you can't do some smell training. So what you do is you still take the smell, but you also consciously talk to yourself about the smell. So you say, well, this is cinnamon, and I'm going to be smelling cinnamon, and you take in the smell. I'm not saying that your smell is going to be restored, but it is also a way of the brain kind of doing some training with the smell while you're doing it. Also, in your everyday life, if you want to be at an event or you want to be somewhere where you want to have some stronger memory of it, take note, be conscious of the smells that are in the environment. So we talk about being mindful, and I know Dreyer, has mindfulness, and, back in the day, we didn't really use the word mindfulness, right? So simply put, being mindful is just being aware of where you are, being conscious of things around you and how they affect you. So for example, if you're in the park, take some moments to smell what's around you, especially at this time of year. Unless you have allergies like me, you may not want to take a very deep smell, but be aware of what's around you. I can have memories, sometimes even when I'm outside. This diesel truck went by the other day, we talk about smells and it doesn't always have to be the nicest smell. So this diesel truck went by and I got this waft of diesel as I was walking, and it took me back to this trip that I had taken years ago with my mom. And I realized the reason is because it reminded me of the plane. We had gotten off at the destination on the tarmac and I could smell the diesel. And it just took me back to that. I had lost my mom last year. And so this smell was a very comforting smell to me when I smelled the diesel. But if I talked to someone and said, oh, diesel brought me a comforting smell, they'd probably be looking at me a little bit weirdly. So familiar smells can be reassuring and comforting. And they can also be used as calming strategies and also a way of you talking. So for those of you who have memory impairment, if you smell something that is familiar from the past, you will remember because those memories are encoded pretty deep in your brain. And I'm going to talk to you about that in terms of music later on as well. So from the study, what did we learn? We learned that smell cues were used during learning and they were used at night. And then they were used again during the testing scenario, and people actually, the students did well. Something I want to mention to you is that companies have been using signature scents like smell, like neuroscience has kind of also gone into business. And I found this quite interesting that companies will also use smell as a way to entice customers in marketing. So one of the ways that hotels do it is they create a signature scent. You're not even aware of it when you go into the hotel or into the room, but each hotel kind of has their signature scent. So what they're basically hoping and banking on is that you're going to have a good time. And now you're going to remember subconsciously that experience is tied to a smell. And the next time you walk in or something, you're going to be, in a good mood, or you're going to say, hey, wait a minute, I had a good time at that particular hotel, be it Hilton, Sheraton, Hyatt, whatever it is. But I wanted to tell you that there are other ways that this is used that we're not even aware of. And so there's no reason why we can't harness it for good, for our purpose here. I'm going to go on to the power of music. And before we start this, and before I get Mary to cue the music, I'm going to be playing some music right now. And I'm only going to do it because, again, I'm priming your brain. I'm going to explain what I'm doing after. Whether you like this type of music or not is not going to matter. Turn it down if it's too loud for you, but I want you to listen to the music. While you're listening to the music, you can close your eyes, you can do whatever you want. But if you feel the urge to move, do it. So if you want to tap your finger, tap your toes, whatever it is, whatever comes naturally to you, do it. And I will ask Mary if we can go ahead and cue the music. It might seem crazy what I'm about to say. Take a break. Hot air balloon that could go to space. Mary's glitching just a bit. Baby, by the way, because I'm happy I'm alone. Because I'm happy I'm alone. If you feel like happiness is the truth. Because I'm happy I'm alone. If you know what happiness is to you. Because I'm happy I'm alone. If you feel like that's what you want to do. Okay, thanks, Mary. I let it go on a little bit longer because the glitchiness did stop Mary, by the way. So I just wanted everyone to hear a bit of the music as it was consistent. So what I also want to show you is now you were listening to the music, but I want to play another video for you in a second. And what they've done is they've done a scanning of the brain. It's called an fMRI, functional MRI. And they can actually show what parts of the brain, how they react when they're listening to music. I want to tell you that it doesn't matter who you are, we all will respond the same way. Our brains will respond the same way. And there's studies been done on this. So no matter who you are, unless you are like a high-level musician or somebody who sings professionally, your brain may react a little differently, but most of us will react all the same. So I want to show this to you, and then I'll explain a little bit. Now, what I want you to note in the video is you'll see things being highlighted in the brain. I want you to note when the music, there's a pause, look what happens to the brain when there's actually a pause, and then I'll talk about it after. Thanks, Mary, if you can cue the video.
Oops. Oh, sorry.
That's okay.
Okay, there we go. Is it good?
Yeah, it looks good. Yeah. Yeah, you just have to press play.
Oh, sorry.
That's okay. It'll take about a few seconds for the music to start, but just look, red is high activation, blue is low activation as you're watching it. So Mary, it's actually in and out. Let's wait and see if it keeps going.
Oh, sorry. Should I start it or?
Yeah, start it again and let's see. That's better. So watch the gap right there. Look what's happening. Okay, Mary, you can stop it and we'll go back to the slides.
Yeah, you're good.
So when you were watching that, I think all of you noticed that what's really interesting about this is that music, it basically stimulates all areas of your brain. If you saw, the whole brain was lighting up, whether that be low intensity or the red was higher levels of intensity. The other thing that was really interesting, I don't know if you noticed this, but when the music stopped, there was a slight stop in the music. That's when most of the brain lit up even more. It was actually during the pauses. When the music got really intense, the brain kind of calmed. The reason is when we're listening to music, you are subconsciously, your brain is starting to analyze the pattern, the rhythm. And when the music stopped, what was happening is the brain was saying, what's coming next? It was actually thinking, what's coming next? It was kind of doing a prediction. And this is really, really neat because this is happening without reading. This is happening without being actively doing something. So I wanted to share this with you. I wanted to show it to you. And there's some reasons why that we'll go into. So I'm going to go to the next screen. So as I mentioned, music is activating all areas of the brain, and we've known this for a long time. What's really interesting is even after listening to the music, the priming effects on the brain remain. We don't know exactly how long they remain. It's temporary, but they do remain. So I'm going to show you later on one last video, which is of a gentleman, and it just really clearly shows you the power of music in this man's brain. But what I wanted to say to you is that the important thing is it's lasting. It's a lasting effect. The role of music in cognitive rehabilitation is growing. I don't know how many of you have experienced this as part of your therapies or as part of your rehabilitation. I really feel like it should be absolutely included in everybody's therapy or everybody's quality of life, especially for those who've had concussions and mild, moderate, and severe brain injuries. We know it helps. We know it works. And listening to music is one of the things in neuroscience that we say it's one of the best cognitive exercises you can do. And what I love about this, about music, is it doesn't matter if it's live or if it's recorded, the reaction in the brain is similar. It's the same. there are benefits to each, but what I like is you can do it on your own. You don't have to go somewhere and do it. Also, I always look at activities, whether they're accessible to people, whether they're equitable, like meaning, do you have a cost associated with it? And I would say that music is one of those things that is probably the most accessible to people in therapy and in their treatments. Not everybody has funds for therapy and treatment. And so I really am mindful of that in my own practice of what I'm recommending. Music therapy right now is being used to address gait problems. This is actually quite fascinating and quite interesting. So for people who have difficulty with coordination or rhythm, balance, they're using music as part of their physiotherapy. I also use music if I'm outside walking with a client. I also use music, not just for social reasons, not just for calming, but also it changes the way you walk. It actually creates a cadence. We call it a cadence. When you walk in rhythm, it's a cadence. So for example, if I'm running, I will tell you, I cannot run without music. I cannot walk without something in my mind. If I have certain music, I feel energized, I feel motivated. And depending on the kind of run I'm going to is the kind of music I'm listening to. But I will pick up my step even when I'm feeling tired. So exactly in those like last kilometer or whatever, I'll pick up my step and it makes a huge difference. I can tell something is happening in my brain with the music. It's also been known to reduce levels of anxiety and depression and agitation. I'm going to highlight the agitation because in a lot of severe brain injuries, we see people become agitated. It's not something they can control. They become behaviorally agitated, and other people think, well, that's difficult to deal with. But what they have found is when they use music in people who are highly agitated, it calms them in a very different way than drugs can do, because what it doesn't do is it doesn't sedate them. So, I mean, drugs may still be used, but music is an excellent way to bring another effect to the person. The other thing is it can improve speech production. So if you think about music and singing, and because singing activates the speech center of the brain. So when you're listening to a song, you don't realize it, but your speech center is actually being activated at the same time. So people use it as part of therapy, especially speech therapists are using it as part of therapy for people who are having problems with their speech or production. It's easier to sing something than to talk, to say it. Also, memory strategy. So I use it as a memory strategy for a lot of people. And I'm just going to tell you something funny that kind of happened, a few days ago. My son keeps asking me why I can't remember his cell number. He got a cell number a few years ago. I have to be honest, I have difficulty remembering new numbers. And he just thought it was like the craziest thing that his mother can't remember his cell number. I finally thought, you know what, I got to do something about this. So on the weekend, I made a little melody to his number and I started saying it to myself over and over again. And I'm happy to say today, I don't know, tomorrow could be different, but today I can sing his number. So, I don't care who's around me when I have to get his number out. I don't want to just rely on my phone. My phone has, it dies sometimes and I need his number. But I just wanted to give you sort of an idea that you can also use songs. You can use a melody to try to remember something. If there's a few items you need to remember, that's actually a strategy that OTs will use often in terms of memory strategy. Like smell, so what's the interesting thing here is like smell, music uses the limbic system. The limbic system is the one I showed you earlier. Sorry, I'm just going to go back to the brain once again. It's these areas with the relay center, the memory center, and the emotional center. And it's using the same areas that I talked about with smell. So it is very powerful. So when you hear music, I'm sure many of you have experienced this. You can be taken back in time. You can be taken back to when you heard that music, where it was played. People will say, oh, I was at that dinner or I was at that wedding and I heard that music. You can also use it as a way of trying to remember the event. By having, if there's music in the background, just being conscious of the music. What is it? What's playing? And that can also help remember the event a little bit better. I'm going to give you some tips, just like I did for smell. Music, the reason why it's so effective is music is releasing dopamine. Dopamine is a chemical. It's the feel-good chemical in the brain. We know this. They know this. They've seen this. What other things release dopamine? Things like drugs. Okay, so drugs, when people get high, they release dopamine. Also, food for some people releases dopamine. It's the pleasure chemical in the brain. So whatever makes you feel good is what's being released. But music does this quite easily. So I'm going to suggest that for those of you, if you can incorporate this as much as you can in your life, listen to recorded music, live music. The nice thing about live music is if you ever can get to it, and hopefully this summer we're going to see a little bit more of it out and about, is that live music increases the socialization. If you've ever seen somebody playing on the street corner or somebody just performing outside, you'll start to see that people look at each other, they start talking, they're like, oh, she's really good. There's this thing that happens amongst humans when we're listening to music and we want to share it with other people. And the nice thing about music is no matter what language it is in, it's going to have the same effect in your brain. So you can listen to Spanish music, you can listen to, Middle Eastern music. It's still going to elicit the same reaction, which is kind of nice because I think that's how we're bounded universally. We can be bounded by music. So listen to music in the background during the day if it doesn't distract you. I know several of my clients, even people who have tinnitus. I don't know if you know what tinnitus is. It's that ringing in the ear. They listen to music in the background as a way of kind of keeping the tinnitus not as disturbing to them. But they have shown that if you're listening to music in the background, as long as you're not feeling like it's disturbing you, it can actually help you do other things and focus. There's also a calming effect that can happen. Sing along to the music if you want, even though if you're not a good singer, if you don't think you have a good voice, do it anyway. Do it when no one's around. No one's going to know. It activates the speech center of your brain. Use the melody, like I said, to remember information. And if you want the social effect, enjoy music with someone else. Talk about your experience or when you heard something. If you went to a show or you heard a band, talk about it with somebody else, or if somebody else was there, you can actually share that with them directly. Use music for self-regulation, for calming. When your mood is not good, when you're feeling anxious, what's really amazing too is that they've done studies and music can actually reduce pain levels. So a lot of hospitals are doing this, especially children's hospitals are doing this now, where they're giving kids music before surgery or before a procedure and after surgery. And they're finding that these kids are using less drugs, but they're also calmer. So it's also a good way of therapeutic use of it. The other way is learn an instrument. And I don't mean like seriously learn an instrument, like you don't have to be serious about all the lessons and everything, but you could do it for fun. It really changes things in the brain, because learning an instrument is like learning a language. And we know that there's a protective effect of those for later on in life with things like dementia and Alzheimer's. There really is a protective effect. So if you know a second language, your brain is already a little bit more protected than those who don't have it. I'm going to go to this video, which is going to be our last video. And I'm going to show it to you. Wait, before Mary, you play it, I have to tell you a little bit about Henry. Henry, Mr. Dreyer, I'm going to call him Mr. Dreyer. Mr. Dreyer is 92 years old in this video. It's a heartwarming video. Maybe some of you have seen it make the rounds. But when I saw this video a few years ago, it really showed me the impact of music on a brain. Henry has dementia. Okay, so I don't know what his past history was. Obviously, I don't know what he had in the past, but dementia obviously is not brain injury. But the reason why I wanted to show you this is because dementia is a really bad neurodegenerative disease. It really shuts down the brain, or so we think. So he was mute. He was pretty much mute, non-responsive for the majority of his day. I want to show you what happens when they give him the music and how that affects his brain. And then we'll talk about it a bit afterwards. So Mary, please go ahead and show the video at starting at 43 seconds.
Oops, sorry, that's not right.
That's
Just give me a
okay.
sec. Okay, here we go. Okay. Is it okay?
Yep.
Hi, Papa.
This is his daughter just coming to see him.
How you doing?
I'm all right. I'm fine. Wait.
Who am I?
He's saying, I don't know.
Okay, it's Cherry. How long has he been in the nursing home? Approximately 10 years. He's having seizures, and my mother couldn't handle him at all. Of course, it affected me greatly because he was always, fun-loving, singing. Every occasion he would come out with a song, no matter where he was. I remember as a child, he used to walk us down the street, me and my brother, and he would stop and do singing in the rain. He would have us jumping and swinging around poles. He was, he was good. He was always into music, always loved singing, dancing. His name is Henry Dreyer.
Uh-huh.
And looking more or less for religious music for him, because he enjoys music and he always quoting the Bible. So I'd rather have
This
that.
is his recreational therapist, and she's just telling what kind of music she's choosing for him.
Unresponsive and almost unalive.
Henry.
Yeah.
Henry.
Yes, so.
I found your music. You want your music now? Let's try your music, okay? And then you tell me if it's too loud or not.
Then he is given an iPod containing, we know, his favorite music. And immediately he lights up. His face assumes expression. His eyes open wide. He starts to sing, to rock, and to move his arms, and he's being animated by the music.
And he used to always sit on the unit with his head like this. He didn't really talk to much people. And then when I introduced the music to him, this is his reaction ever since.
The philosopher Kant once called music the quickening art, and Henry is being quickened. He's being brought to life. Yeah.
I'm going to take the music for 1 second, okay? Just to ask you a few questions. Okay?
So watch what happens when they take the music away and they talk to him. And this is a man who is pretty mute.
Stop, because when the headphones are taken off, Henry, normally mute and virtually unable to answer the simplest yes or no questions, is quite voluble.
Henry.
Yeah.
Do you like the iPod? Do you like the music you're hearing?
Yes.
Tell me about your music.
Well, I don't have one, I mean.
Do you like music?
Yeah, I'm crazy about music. You play beautiful music, beautiful sound. Beautiful.
Did you play music when you were, did you like music when you were young?
Yes, I went to big dances and things.
What was your favorite music when you were young?
Well, I guess, Cab Calloway was my #1 band guy I like.
What's your favorite Cab Calloway song?
Oh, I'll be home there for Christmas. Oh, you can count and plan on me with plenty of snow near the toe. Present, brand new tree. Ow. So, in some sense, Henry is restored to himself. He has remembered who he is, and he's reacquired his identity for a while through the power of music.
What does music do to you?
Give me the feeling of love. No man, figure right now the world need to come into music, singing. You got beautiful music here. Beautiful, oh, lovely. And I feel the band of love, dream. Lord came to me, made me holy. I'm a holy man. So he gave me this sound. Started to say, I meet you. Let me see. Rosalie, won't you love me? Rosalie.
Okay, Mary, we can stop the video. So I want to play the video of Henry for you because it, you know, I can tell you all the words, but I think the picture is powerful. This is what happens in a dementia brain. So we can play music and the person can remember. I had a client many years ago who was completely unresponsive. And when we played an Irish jig from his childhood, he actually started moving and wanting to dance with his wife. He actually had more control of his body when we played the music. It was the most beautiful thing I've seen. But I wanted to show you that because the power of music is not just in the moment that you listen to the music. There is a lasting effect. So, you know, for families and caregivers, for somebody like Henry, you know, people, even his support staff around him who probably didn't think about this stuff when he was unresponsive. This is a person. This is an individual who had likes and dislikes and had a love of music. And now you can sort of see his personality come out. And it's a very powerful thing. So I wanted to share that with you. And before I go back to the slides, I just want to let you know that for all of you, it's just what you can do and how you can incorporate it. These are just some tips. And again, if you want to learn more, and you know, I'm happy to say, I did not know this when I did this talk, but Meyer's going to be doing some music therapy come the fall. We're going to be doing some programming. So this was really great timing, which we did not know was going to happen that way. But what I could do is if there's feedback, it might be a nice fit to kind of do a summary of the music side of this talk again before we start the music program. And we could even do a part 2. So feel free to give your feedback after the fact, and we could do that. So what I'm going to do is I am mindful of the time, and I'm going to go on to thank all of you. I have a Billy Joel quote there. I'm going to leave it there. But, you know, Billy Joel says, I think music in itself is healing. And he goes on to talk about music. But I'm going to ask for any questions. And even if you want to share, please, I greatly appreciate any of your sharing. And obviously, we're doing it being mindful of everyone's privacy in the space, but we are being recorded. So I do want to just mention that as well.